Hey everybody, Dr. Hagmeyer here, and today I wanted to shoot this video on the connection between beautiful skin and gut health. Okay, this is an incredibly important topic. I think a lot of women and men suffer and find themselves really at a loss of what to do. And after numerous attempts of trying to find and improve their skin with antibiotics and cortisone creams and lotions and potions and moisturizers and shampoos, all different kinds of cleaning agents, eventually they just give up and they live with it. And sadly, because we live in a society where we are constantly being judged by our outer appearance and our looks, our self-esteem and our self-worth at times can really take a beating, and it shouldn't have to. And I hope this video will help you think about your skin just a little bit differently, as well as give you some ideas on how to improve your skin naturally. Okay, so if that's you, this video, I hope that after watching will help you understand some of the root causes behind these problems, and you can walk away with some things that you can do and implement and start to turn this around. Now, what if I told you that psoriasis and acne and rosacea and itchy skin and bumps and hives and seborrheic dermatitis and probably a whole slew of other different kinds of skin conditions are actually stemming from the gut? Would you believe me? Okay, so in other words, the skin problem that you're experiencing is not coming from your skin, and instead it's coming from an unhealthy gut. All right, would you believe me if I said that? Well, if I had said that 10 years ago, you'd probably think I was absolutely crazy, but more and more research today is actually showing that many of these skin problems are actually tied and can stem back to the gut. Now, I'll tell you, as a doctor who works with lots of different kinds of patients with all different kinds of chronic health problems, everything from hormone problems to thyroid problems, I'll tell you that most of my patients have itchy, unhealthy skin, eczema, and psoriasis, also have gut issues, okay? They almost go hand in hand, okay? And if you can identify some of the causes behind why your gut is unhealthy, you can have nice, healthy, beautiful skin. And this is just a classic example of how sometimes if all we do is focus on the area where the symptoms are, we're going to miss where the problem are really coming from. All right, so now I want to talk to you about a couple of problems or conditions that I see time and time again with people who have skin conditions, and the things that you should consider having tested if you are interested in having healthier looking skin. And these are things that I would say thinking outside the box, so to speak, from the typical dermatologist. Okay. I'll also say for the record that a healthy gut goes a lot further than just healthy skin. Okay. There's so many things that we see being tied into the microbiome and the gut, and how an unhealthy gut causes just a slew of health problems. So again, if you can relate to these things, all the more reason for why you should pay attention to the things I'm going to be talking about in today's video. So here are four things or four aspects of gut health that I think every person who's suffering with a skin problem needs to consider. All right. First, I'll tell you what these four areas are, and then I'll explain to you why they're important and how they can be a key, like really just hold the key to more beautiful skin. Okay. So number one is a leaky gut. So if you're taking notes, I would write down leaky gut. Number two is I would write down infections. Okay. Infections could be any kind of infections. Like this could be an overgrowth of a bacteria in the small intestines known as SIBO or SIBO, small intestinal bacterial overgrowth. It could be small intestinal fungal overgrowth, or SIFO. Okay, this is instead of now a bacterial infection, this is a fungal overgrowth, like a yeast. It could be parasites, or it could be a buildup of bacteria called H. pylori. Okay, these are all things that I consider from an infection standpoint when there are some skin issues. The third area that I like to consider are liver and gallbladder problems. And now this is especially important if you have fatigue, if you have itchy skin, if you have a history of sugar cravings, or you've been on birth control pills. These are all major areas that can impact and cause a sluggish liver, cause a sluggish gallbladder. Okay. These are all things, again, that I like to think of as it relates to detoxification. And again, this is where the liver and gallbladder plays a very important role in detoxification. The fourth area I like to consider is what we call gut dysbiosis and inflammation. Okay, now you may be thinking, Well, Dr. Hagmeyer, what about food sensitivities, and what about nutritional deficiencies, and what about hormones? All right, and while I wouldn't dismiss any of those things, those are all very, very important areas also to consider when it relates to skin problems. The thing I would mention today is that this video is going to focus on, again, those overlooked areas. I'll come back and I'll do a video on these topics at a later date and time, but for today I wanted to focus on the connection between the gut and the skin, okay? So let me just tell you a quick story. I had a girl that I began working with probably about 3 months ago. Her history was that she had terrible hormonal problems, something called polycystic ovarian syndrome, or PCOS. She was constantly bloated. She had eczema on the back of her elbows and the back of her knees. And the only thing that we did in the initial phase of her treatment plan was we worked on repairing her gut. And in 3 months, she had noticed and had made mention that her hair and her skin and her nails never looked so good, okay? Her hair, her skin, her nails, okay? Very important areas. And again, if there's usually a problem in one, we often see problems in other areas as well. So again, don't underestimate the power of the gut, moral of the story. So let's break down and unpack these 4 main areas, starting with something called a leaky gut, okay? So if you don't know what a leaky gut is a condition where the gut itself becomes very, very inflamed, and areas where the intestinal lining is really, the cells themselves are actually held together. What happens with a leaky gut is these tight junctions, these proteins holding these cells together, come loose, okay? And these tight junctions kind of separate a little bit, leading to permeability. And instead of acting like a barrier, preventing things from coming in and passing, things coming in and going out, they become more porous. So think about a piece of Swiss cheese, right? So there's big holes, there's small holes. Well, what happens with intestinal permeability is these openings or these holes become bigger, and now what happens is various endotoxins and proteins can come through that barrier, okay? So again, toxins, bacteria, hormones, large proteins like gluten, all of these things that normally would be prevented from entering into the bloodstream because of the tightness, now are not able to go through. So again, we lose this ability to maintain structural integrity, okay? And now what happens is, again, these foreign agents are now able to cross through that barrier, which again would normally be walled off. Now, what we know in terms of why that's bad and what happens is something that we call inflammation, okay? Now, inflammation, again, is experienced through that leaky gut or that permeability. And not only do we experience this leaky gut, this inflammatory reaction in the gut affecting our skin, it goes on to affect things in other parts of the body, like leaky brain, leaky lungs, right? So we end up with a lot of respiratory tract infections, and maybe that's you, okay? Leaky brain, so maybe we end up with things like brain fog and things like headaches and migraines and depression, anxiety. Again, these are all related back to that leaky gut, okay? The good news is, in terms of what we know, is from research standpoint, is that we know that specific strains of certain kinds of probiotics, one of them is called Lactobacillus plantarum, the other one is called Lactobacillus casei, okay? These have both been shown to downregulate the production of these inflammatory mediators. These are called cytokines. So these inflammatory chemicals can be kind of quelled, they can be calmed down by the introduction of these very specific probiotic strains, okay? This means that the ability to reduce this inflammation at the level of the skin is also going to impact the immune system, and what we call that immune tolerance, okay? So while many people are increasingly becoming aware of this leaky gut, the skin and, again, the brain are also areas that become leaky and porous due to these issues, this leaky gut, okay? So here's an example of what a leaky gut looks like, and also this is actually a test of one of my patients who, if you notice here, you're going to notice this is a test looking at leaky gut, or testing for leaky gut rather, and you're going to notice that there are various markers, occludin and zonulin, and then LPS, which stands for lipopolysaccharides, and then there's the immune system's reaction, IgA, IgG, and IgM. And if we have any of these markers that show up out of range, this would be characteristic of a diagnosis or let's say findings related to this leaky gut. So that's a little bit about leaky gut. number two, or the second area that we want to talk about, another problem that's, or another area rather, that's worth considering when you're struggling with unhealthy skin and itchy skin, and especially rosacea, is an overgrowth of bacteria in the small intestines known as SIBO, small intestinal bacterial overgrowth. We talked a little bit about that, or made mention of that a little bit earlier, okay? Now, SIBO occurs when the bacteria in the large intestines are able to migrate up into the small intestines, okay? And that's a problem because normally the kinds of bacteria that are found in the large intestines are not the same kinds of bacteria that you would expect to see in the small intestines, okay? So in other words, you shouldn't have the bacteria found in the large intestines present in the small intestines. Now, to detect this and whether or not you have small intestinal bacterial overgrowth, there is a test called hydrogen and methane breath test, okay? This is a very, very important test. This is really the only, well, this is probably the most accurate method for identifying bacterial overgrowth, okay? So some of the symptoms you might experience with small intestinal bacterial overgrowth are things like bloating, okay? Bloating, belching, gas, constipation, diarrhea. Maybe you've taken some probiotics in the past, but you had an adverse reaction to them. Maybe you felt more bloated, okay? Maybe when you eat certain kinds of fruit, you blow up. It feels like someone just took a pump and just pumped up your belly, right? So again, if you experience these things and you have skin problems, this is, again, something worth considering, small intestinal bacterial overgrowth. Now, one thing I will say is I've done several videos in the past about small intestinal bacterial overgrowth. So if you're interested in watching those videos, simply go to Google or go to YouTube and just type in small intestinal bacterial overgrowth and Dr. Hagmeyer. And there's probably 11, 12, 13 different videos that I go into, you know, what SIBO is, you know, what causes it, kind of how you want to approach it, and so forth. So again, if there's more information that you want on SIBO, you can go back to that. I'm just going to cover a couple of the more important parts, okay? Now, as it relates to SIBO and infections, okay, the thing that I would like to stress here is that small intestinal bacterial overgrowth is not the same kind of infection you get when you have, let's say, an ear infection or a respiratory tract infection, okay? Most of the time with these kinds of infections, you know, maybe you go to your doctor, you take an antibiotic, and the antibiotic wipes out the infection, and, you know, within 7, 10, 12 days, you know, you feel like your old self again. The problem with SIBO is that it's not very responsive to antibiotics. And if you have SIBO, you'll need to work with a doctor who has a grasp and an understanding of not only what you need to do from an infection standpoint, but also there's a very special diet called a low FODMAP diet that has been incredibly successful as one of the keys to overcoming SIBO, okay? It's not the only thing you need to do to eradicate this SIBO, but it's one thing that becomes an important key in eradicating SIBO. All right, now, if you have SIBO, again, one of the things you're going to need to work very hard is just in terms of getting rid of it, okay? Not only are you dealing with an infection, but again, it's not there just because of the infection standpoint, okay? You can't just kill it, in other words. You have to understand that this bacteria is something that you have to change the environment to the gut, okay? So again, if you address that component, you're going to be very successful in getting rid of the SIBO and also in clearing up your skin and having healthier skin in the first place, okay? So if you think you have SIBO, again, it's an easy test to be tested for. Again, you're going to want to look for a 3-hour hydrogen and methane breath test, okay? In the past, there were 2-hour breath tests, there were an hour-long breath tests, but more and more studies have come out showing that it's the 3-hour breath test that you really want to have done that looks at both hydrogen and methane, okay? So another skin condition that's been associated with gut disorders, okay, especially Crohn's disease, liver disease, infections with H. pylori, even something called chronic pancreatitis and gallbladder disease, as well as rosacea. And again, this is what rosacea looks like, okay? So if you've ever wondered what rosacea looks like, or you think you might have rosacea, here's a picture of what it looks like, okay? So to make a long story short, if you've been diagnosed with any of these GI conditions, Crohn's disease, liver disease, infections with H. pylori, even if it's a past infection, chronic pancreatitis, okay? Even if these were all negative, but you've never been tested for SIBO, I highly recommend that you get this test, okay? The other thing I'll make mention here is that I will leave a description, okay, about SIBO in the description part of the YouTube video. Okay, so if you want more information on that, you can just click on it, and it'll take you to some additional areas as well. Now, other considerations along with SIBO is something called hypochlorhydria. Okay, now this is a big fancy $5 word we doctors use, but basically, essentially, what's happening here is you have low stomach acid. Okay, now the thing to understand about hypochlorhydria is that it often goes hand in hand with SIBO. Again, it's not the only cause of SIBO. It's a contributing factor, and it's something that if you identify, it's something that you want to correct. And again, this low acid, this state of low acid in the stomach called hypochlorhydria, this has been associated with acne. Okay, studies and studies show that low stomach acid causes acne. So again, something to be aware of. Now, another area from an infection standpoint implicated in unhealthy skin stems from parasites and yeast infections. Now, here's why. As we talked about earlier, one of the big problems that we see with skin conditions is chronic low-grade infections and inflammation, right? So if you have this chronic low-grade infection and you don't even know you have it, little by little by little, continuously, you're inflaming what we call the gut-skin axis, okay? So again, something to consider, inflammation, infection. So as a summary, we talked about SIBO, we talked about parasites, we talked about low stomach acid, we talked about H. pylori. All of these things are potential gut issues, okay, that can really affect the gut-skin barrier, okay? The third area I like to talk about is the liver and gallbladder, okay? Again, skin conditions are especially common problems in women for a number of reasons, okay? You're dealing with monthly fluctuating hormones. You're dealing with all kinds of chemicals found in your makeup, in your hairspray, in your deodorants, in your hair care products, in your soaps, and in your shampoos. And then there are things like birth control pills that maybe you've taken for years and years and years. There's environmental toxins like bisphenol A and phthalates and things like sodium lauryl sulfates. Okay, you can Google any of those topics with skin problems, and you're going to find that there's a lot more out there than you think. Okay, a lot of these environmental toxins can actually be related and cause and exacerbate skin problems. Dr. McCullough, okay, wrote an article that states basically the average woman puts on 168 different kinds of chemicals on her skin every single day. All right, so just imagine how your body and your liver is just literally being bombarded day in and day out with not only chemicals from the outside, all those things that we just mentioned, but also the chemicals from the inside, such as the endotoxins caused by a leaky gut, or the bacterial toxins caused by bacterial overgrowth, or by candida infections and fungal overgrowth, okay? All those things that we just mentioned, okay? So when you think about it, unfortunately, some people have no chance at having unhealthy skin until they begin to identify these things, okay? And sadly enough, the worse their skin looks, the more they're looking out of just desperation to put something on their skin to cover it up from the outside, all right? I see this especially with young girls, okay? That's, again, why your liver is so important. If you don't have a way of eliminating these toxins, or your liver is compromised, or you are missing your gallbladder because it's been taken out, these toxins can't be eliminated as efficiently, and then they build up in the body, right? And combine that with the standard American diet, which we didn't even talk about, okay? And now you can see why so many men and women suffer with skin problems and skin challenges. Now, while we're on the topic of the liver, it's worth mentioning that some people, especially if you're a woman, and these are some really classic symptoms that I want you to be aware of. If you're a woman and you have a history of autoimmune diseases, and you have bloating, and you have abdominal pain, and you have itchy skin, okay, that's the key. You have itchy skin, you have high cholesterol, maybe you have chronic joint pain, osteoporosis, maybe a diagnosis of osteoporosis or osteopenia. It's very important that you get checked for biliary cholangitis or cirrhosis. Very important. In biliary cirrhosis and cholangitis, little by little, the network of tubes linking your liver to your gut are being destroyed, okay? And this is a very slow process. And so sometimes in the earliest stages, you can't identify this. And there are some specific markers in your blood work that can identify this, but only as, unfortunately, as the scarring and the inflammation kind of advances, okay? But again, the point being here is with this condition, your bile ducts are becoming scarred and they're becoming inflamed. And now, of course, the bile can no longer flow through these ducts the way they should, and that causes, again, this reabsorption of all these toxins. Now remember, it is your liver that makes the bile, It is your gallbladder that stores the bile, and most importantly, the purpose of bile is to break down fats, okay, and also remove toxins from the body by moving the bowels, okay? So the key here is you can't be constipated. You have to have 2 to 3 bowel movements per day. Now, if you remember what I just said, the purpose of bile is to break down fats, okay? So the key here is if you can't break down fats, you become bloated, but you also become increasingly deficient in many of your fat-soluble vitamins. Vitamins A, vitamin D, vitamin E, vitamin K. Again, many, many different important antioxidants, not only important for gut health and mucosal tissue regeneration, but also for healthy skin, antioxidants, okay? The other thing that we often see when you can't break down fats is your stool is light gray or it's light brown, and oftentimes it'll float in the toilet, okay? So those are all classic signs that you might have some liver and gallbladder problems, okay? So be aware of those. Let's talk for a moment about a couple of other additional things as it relates to sluggish bile. If you have sluggish bile flow, let's say because you've been on birth control pills for a number of years, then your ability to digest fats, remove toxins from the body is going to be compromised. And if you don't get rid of these toxins, your body reabsorbs these, and you end up with unhealthy skin. You end up with acne, you end up with itchy skin, you end up with dry skin, you end up with psoriasis, you end up with rosacea, and I'm sure there's a whole slew of other problems that you could, other skin problems that you can identify with, okay? Studies have shown that both stress and gut inflammation can impair the integrity of the protective barrier of your skin as well, specifically called the epidermal barrier, okay, the epidermis. So this is the outer part of the skin, okay? Now, again, the importance of the epidermis is that it produces antimicrobial agents, right? And what's so amazing is that on a daily basis, our bodies are being bombarded with all different kinds of bacteria. But the very nature of how innately and marvelously our bodies have been created is that this epidermal layer naturally produces antibiotic properties, okay, that wards off the skin from developing this infection. But in some people, again, because of all those things we just mentioned, that epidermal barrier, especially with the lotions and the potions and the drying agents, becomes damaged. And now we've lost immune tolerance. All right, hey guys, back again. I think apparently I ran into a couple problems with my memory card being filled there. But nevertheless, we had left off where I was talking about how chronic stress and inflammation has shown is a problem affecting the epidermal barrier of our skin. And so if our body, if we've been under a lot of stress, whether it's physical stress or chemical stress or emotional stress, realize that these kinds of stressors are going to affect the outer layer, the epidermal barrier of the skin. Again, that's the layer of the skin that fights off constant bacterial infections, right? So it's very important that we have to also address stress and how stress affects the gut, and how the stress-gut inflammatory connection is with our skin. So let's talk now about the fourth culprit when it comes to unhealthy skin, and this is dysbiosis. Okay, now when we talk about gut dysbiosis, we're really talking about the gut microbiome, and it's this microbiome which I like to think of as a rainforest, and it's filled with many, many different kinds of bacterial species. Some good, some bad, and of course some that are just opportunistic. Now, just to give you a little perspective on the greatness of this microbiome, how big it is in comparison, the latest study shows that the number of human cells in our body is 37.2 trillion cells. And to think about that number, that is just a mind-blowing number. But the microbiome itself is 10 times that number. So when you think about it, the gut itself is teeming with life, teeming with activity. And for many patients, they have noticed the correlation of having nice skin prior to antibiotics, and then after antibiotics, very unhealthy skin. Okay, so this is no surprise because this is well documented throughout many, many research papers. So in many cases of skin conditions where whether we're talking about rosacea or psoriasis or eczema or acne or dermatitis herpetiformis, what you see is not only a loss in the what's called the abundance of these bacteria, but you also see a reduction in what's called the biological diversity. And what that means is that not only is there a reduction in the number of good bacteria, but there's also a reduction in the various strains of bacteria. Okay, so the greater the number of strains, the healthier the gut. I like to use a specialized stool test which is unlike the kind of stool test that your typical GI doctor might look at. This is called a functional stool test because this test was designed to specifically look at the various strains of the person being tested, okay? If you look at the image here on the left, what you're going to notice is that the diversity association is very, very low. And if you look at the image on the right, you're going to see that the patient is deficient in many important species of good bacteria, many different strains, if you will. One thing I always like to show patients when I want to run this functional tool test is this image. And what you see here is you see a person before they started a 7-day course of antibiotics, which is this day 0. And now, if you look, you're going to notice the bacterial diversity is completely wiped out by day 7. Again, if you look at day 21, if you look at 3 months, if you look at 6 months, if you look at 9 months, even 2 years later, the bacterial diversity still is not back to normal. And now, just for a moment, I want you to think about how many rounds of antibiotics did you get as a kid? Did you have ear infections? Did you have respiratory tract infections? Did you have any surgeries? Any hospitalizations? Even if you had been to the dentist probably put you on antibiotics when you had your wisdom teeth removed, okay? Or maybe you had a root canal. When you really look at our lives and how we treated our gut, you can see that over the years it's been bombarded time and time and time again, almost like an atomic bomb has been dropped on it. So as I wrap this video up, there's a couple things that I really want you to remember. Number one is that there are many reasons behind unhealthy itchy skin. Okay, we talked about some of the GI problems that I often see with patients. So we talked about SIBO, small intestinal bacterial overgrowth. We talked about SIFO, small intestinal fungal overgrowth. We talked about leaky gut. We talked about dysbiosis. We talked about H. pylori. We talked about liver and gallbladder function. And while I didn't have time to get into, in this video, things like hormones and thyroid levels and stress hormones and nutritional imbalances and food sensitivities and food allergies and all these other things, these are all very important when it comes to health, okay? And so a healthy body has healthy, beautiful skin, naturally, right? It's only after we bombarded it with toxins and a bad diet that we end up with unhealthy skin, okay? So number two, if you like today's information, give it a like, give it a thumbs up. Make sure you subscribe to my YouTube channel, right? I enjoy doing these videos. I have a lot of fun doing them. I love hearing all the comments and things like that and people you know, putting positive things. These videos always are just an encouragement to me to continue providing great information to you guys, okay? And lastly, if you want to learn more about functional medicine, visit my website, okay? You'll find over 1,000 pages of health-related information on topics. You'll see patient testimonials. You'll see recipes for eating, and even just more information about some of the things that we've talked about in today's video.